Good morning, and thank you for joining me on this rather wintry spring morning here in Erie County as we discuss the COVID-19 pandemic here in Erie County. Today we have 2 new confirmed positive cases in Erie County, which brings us to a total of 37 positives. And we've had 884 total negatives. Both of these new cases are in their 60s. These cases just came in this morning, so investigations are underway by the Erie County Department of Health. I can tell you that 1 case is in Zone 4 and 1 is in Zone 5. And you'll find this reflected on the new map we launched that reflects the latest cumulative cases by zone on the confirmed positive COVID-19 cases across Erie County. The map will be updated Monday through Friday at eriecountypa.gov. We understand that other counties and cities are providing updates on hospitalizations and patients on ventilators. While this information may be interesting to know, we have to look at it from a public health perspective and how it would or would not benefit the community to have this information. Gathering, monitoring, and reporting this information accurately requires staff. And right now, our county Department of Health staff are working diligently on the many other responsibilities to this pandemic that are truly the tools we have to stop the spread in our community. We don't think that redirecting precious resources for this specific information is in the best interest for the overall public health of our community. The world-class hospitals we have in Erie County are responsible for their patients and for their patient information. They have shared what information they can and likely will over this time period. This virus is serious, and we know it's deadly. So we just want everyone to stay home and to stay physically distant from others. This continues to be our message, and it is working. At the start of this week, I said to prepare for a rough week ahead. While we do not want to see any new cases, we are pleased to see that our numbers still remain fairly low, especially in comparison to other communities. Sure, that has a little bit to do with the lack of available tests here and around the world, but I believe it has a lot to do with the people in our community working very hard to follow the guidelines. Physical distancing, isolation, and quarantine measures implemented by my team at the Department of Health seem to be working here in Erie County. So please continue to practice these measures. You are truly saving lives. I heard someone say that this is an opportunity for every one of us to be superheroes by staying home, by staying physically distant from others. So please only go out when absolutely necessary. Remember to wear your mask when you do and stay at least 6 feet away from others. It truly is the cool thing to do to wear a mask these days. Shop only when you absolutely need to. When you come home, make sure you thoroughly wash your hands and wash your hands frequently anyway. Don't touch your face until you have thoroughly washed your hands. Quarantine yourself if you've been instructed to do so or have traveled to another area around our country. And don't meet with groups of people. We know that the virus is mostly spread person to person, so the less you're around others, the better for them and the better for you. State numbers have not been reported as of yet today, so look for those later today at health.pa.gov. On another note, our community is small, and unfortunately, rumors like to spread. Rumors and misinformation can be extremely detrimental, especially in times like these. I understand that people are angry and frustrated, scared and bored, but please be responsible with the information you seek and share. Make sure you have all the facts from a reputable source. Let's stay ahead of the spread of COVID-19 in Erie County in every way. You can always check eriecountypa.gov, the CDC's website, or health.pa.gov, and the social media channels for those entities for really the most up-to-date and accurate information. A reminder about these daily briefings for this holiday weekend. Tomorrow, we will be here at 3 p.m., and there will be no briefing on Easter Sunday. We'll resume our regular 3 p.m. briefings on Monday, April 13th. Finally, as I've mentioned every day this week, this is National Public Health Week. COVID-19 is a turning point for public health. State and county health departments are truly at the forefront of this crisis. We have the extreme benefit of having a county health department. The health departments are leading the charge during this pandemic, and yet they remain invisible. Why? When people see a natural disaster like a tornado or an earthquake, they can see and then they believe the need is there. They see the shelters created for those displaced, and the people handing out food, and the emergency responders rescuing people. It's very visual. In a pandemic, public health workers can't be visible because of the private nature of personal health. Their time and talent is truly focused on saving lives. All that they can tell us, the public, are numbers, general guidance and recommendations, and provide us with education. All the while, in the background, they are testing, obtaining and analyzing lab reports, conducting interviews with our positive cases, coordinating with our healthcare systems, law enforcement, our municipalities, emergency service, and the list goes on and on. Our culture of instant information now expects an abundance of visuals of what's happening and snappy responses. We hope that our new map, which we'll put up here for you, helps provide a visual, but overall, this pandemic doesn't work that way. Information changes at a rapid pace. Testing takes time. Contact interviews take time. Reporting takes time. And everyone is working around the clock to bring the information to the public. We need the community to understand that public health is just that, overall public health and welfare. The Erie County Health Department is doing all it can to prevent the spread of this virus, to pull together all of the necessary players to prepare for anything that might occur. The health department would not compromise the community by withholding information that would be vital for your protection. It goes against all that we do. We are holding briefings almost every day to keep you informed with the latest information that we have to share. I'm grateful for everything that our public health practitioners do, and I can sleep better at night knowing that they are always ready to respond with excellence. And you should feel confident and sleep better because of that too. Thank you to all of our public health workers, especially on this week. We applaud you for all that you're doing for us. And now I'd like to open it up to the media for questions, and today we'll start with the Erie Times News.
Hi, Kathy. It's David. I want to talk a little bit about the map first. Take me through the process what led the county to post up this regional map and at least identify general areas where the cases are. Was this something that's been in the plans for a week or two or just a few days? And take me through the decision-making process of actually making that public.
Sure. When we talk about the map, we've been talking about this, and I know the media has been asking us about this as they saw maps come up in other communities. In the beginning, we just didn't feel we had enough numbers to do this because one of the things is I was afraid of would give people a false sense of security. If they saw a map and there was no cases in their area or in their exact municipality, people might think, well, I don't have to worry about it and I can just go about doing my normal activity. And that's something that we know is not true because people move across boundaries for shopping and to go to other necessary things that they need to go to, work, for example, for a lot of people that are in those essential businesses. But once we started to get a few more numbers, we looked at how we could do this in a way that would make sense. So we used the 5 zones that we actually already use for our first responders. And these 5 zones came about through our very large radio project, Next Generation Radio project that we did. over the past few years. So our first responders truly understand that map because it's something they deal with every day as they respond, whether it be to a fire, some kind of crime, or to emergency where they have to send an ambulance. So this made sense to us, and so we put that map up according to those zones.
And a majority of the cases are the city of Erie and Mill Creek, which are also the two biggest population bases. What can people extrapolate from this? I mean, at first they see there's a lot of cases in the city and in Mill Creek, but I mean, is that the caveat that, well, yes, there's more cases, but also there's a lot more people in those two areas?
I think that's exactly right. In the city, of course, we have about 100,000 people who live in much closer proximity to each other than in many of our more rural communities. And so their neighborhoods, their shopping, everything they do is more concentrated, so therefore allowing a virus to spread more easily. I think that's why obviously you see huge issues in places like New York City and Los Angeles and Seattle and places where people where there's a large concentration of people. Mill Creek is also a very similar community to Erie, has about half the people in it, but still a very large population, I think maybe around 52, 53,000. Of course, I guess I could throw in a shout out for the census. We need everyone to be counted, so we actually know what those true numbers are. And but Mill Creek has a lot of individuals living there also, and so they have still a large number in comparison. But even today, our two new cases are out in our zones that we consider more of our rural areas and suburbia, rural. And so, no one is immune to this virus. It knows no boundaries. As my director of public health said the other day, it's a sneaky virus, and there's a lot we don't know about it. So no matter where you live, you can look at those numbers, but please don't get complacent and think, well, it's not so bad in my region. Know that those numbers could change at any time. And it's a real concern as this virus has continued, that it's getting more out into the suburban and rural areas. Jet TV?
Yeah, hi, Kathy. It's Samir. So, of course, we know this week we were supposed to see a big surge, as we kind of have across the Commonwealth. So what do you think that means, I guess, for Erie not really seeing a significant spike?
So we had 19 cases a week ago, and now we have 37. So we have not doubled our numbers, which is great, but it's come close to that. So actually we're only one less, right, than doubling our numbers. But in many places, we've seen numbers double, triple over days, and we haven't seen that kind of a surge. So we are seeing those increased numbers. We also are seeing increased testing, so some of that may align. But I think we are in still a very good place compared to so many other communities, and that's because people are really helping us. I've said from the beginning, we can't do this alone. We can only do it with the assistance of our citizens, the residents of Erie County, and people are really taking this to heart. And so we have the cases still coming in. Instead of one a day or one every other day, now we're seeing 2 to 3 a day, so, but not obviously the numbers we see in other places. So we hope that we can still stay in one of those communities where COVID does not take hold. We have no deaths, and I'm so grateful for that. So many other communities have had to deal with that terrible tragedy. And I was listening on my way here in New York. They had 799 deaths yesterday. I mean, it's just so terrible and so tragic, and that's something we want to avoid here. So thank you, everyone, for continuing to do what you're doing. Erie News Now?
Hi, a question for you about this weekend. With the holiday weekend, will you have more crews out and about, and what kind of is the plan trying to make sure that people aren't gathering as much as they'd like to? How do you try to keep people safe here and prevent those gatherings, at least for now, during this pandemic?
Well, the way we can prevent them is for everybody to do the right thing. This is the holiday weekend. Easter in the Christian tradition, Passover was just 2 days ago. This is a time when families are often just gathering, of course, churches gathering, but most of our churches, I don't know of any actually that are still holding services. I did see one church that was holding them in their car, and the pastor was on a microphone. So if you can keep people socially distant and do something unique and different, I'm not suggesting everyone do that, but I'm just saying, churches and other gatherings have just found new ways. We know that many are doing online services, so that's obviously a great thing to do, and keeping everyone distant. We're all learning how to use technology, whether it be Zoom or whatever technology we're using. It's very interesting. I was on a call actually yesterday with almost 500 people, and so it can work, and we can still connect, and we can still ask questions, and we can still relay information back and forth. So we just need people to do it. I mean, our enforcement teams will still be there. We will have our line 451-6700, which is always open and taking calls, and we have a 24/7 answering service on that, and then if there's anything we need to address, can be. And of course, our law enforcement agencies throughout Erie County are assisting greatly with breaking up any gatherings that they might see, so whether it's our local police or our state police, they're out there doing their job. And so it really takes a whole community to make this happen, but it first starts with the individual and the families to stay apart, stay at home, find new ways to celebrate your holiday than you have before. It will be a Holy Week, an Easter, a Passover that we will all always remember.
Can I just follow up on that for just a moment? As you mentioned families, do you worry at all about families trying to get together, even if it's not for a religious service, just trying to get extended families together? Is there any increased concern of that over this weekend?
I think that's a concern every weekend, maybe this weekend more so. I just ask people to think about that and think about where other people in your family could have been, and that they could be a positive carrier of COVID-19 and you wouldn't know that. I heard a story just on the news, maybe others heard it too. There was a family, I think they had 4 daughters, the mom and dad and the 2 sets of grandparents got together for a birthday, just their family, and now every single person in that household has been tested positive for COVID-19, and I know at least one of them was in the hospital on a ventilator. So that's what can happen to us if we decide to get together with our family. We just don't know who the carriers are. We know that there are many people who are carriers and don't know it. So on no fault of their own, they could pass this along, and especially if you pass it to your grandparents or to somebody who is compromised in their health, it could be tragic. So I ask people to think about that, to save lives and do the right thing. Talk Erie?
Yes, good morning, Kathy. It's Joel Natale. I want to go back to the creation of the map and the comparison with maybe counties like Chester County or Allegheny County, where it's more of a municipal reporting mechanism. Are you saying that is giving people a false sense of security in those counties as opposed to Erie County? And just to follow up, can you also speak to perhaps utilizing Jeff Kidder, the county's data guru, using GIS or the university statistics departments to help out and take that burden off of the health department for granular data?
Actually, this wasn't created by the health department. It was created by our GIS officials in the public safety department. And Jeff Keeler, who is very talented, has been involved in some of these works too. So it's not a hard thing for us to do to update it and to keep it current, but we need to get the information, obviously, from the health department in terms of the addresses so that we can put in the right zones. I can't really make a judgment on those other communities. I mean, Chester County, Montgomery County, some of those other counties in the southeast have huge numbers, huge caseloads of COVID-19. So I don't know if every community in those counties has cases, but I would think that may be true. And so there is no false sense of security anywhere because it's so rampant and they've had deaths and it's been tragic what's happened in the southeast of our state. So we will continue to look at this as we go forward. I hope that we just never have great numbers that we would have to, even dig in deeper, but it helps people at least to see in their region, how widespread is the COVID-19. Erie Times News?
Yes, Kathy. On hospitalizations, you addressed that a little bit in your opening remarks, but I want to be clear. So does the health department, does the county and the health department know how many folks are being treated for COVID-19 at Erie County hospitals and just making the decision not to release that publicly? Or does the health department not know how many people are being hospitalized at any one time?
There is no database that we have access to that shows us who is in the hospital, who's not, who's on a ventilator, all of those type of things. So that's acute care, and we're public health. And although we have good relationships and information is sometimes shared back and forth, we have not been privy to the information in the hospitals. And that's okay because we're public health. We're trying to stop the spread of COVID-19 across this community. That's not to say we aren't having conversations about how the hospitals can, continue to protect their employees and the people that work there, and that we aren't helping them out with personal protection equipment and those type of things. So we have a great relationship, but it's not like the databases that we look at for the active cases. If they go into the hospital, for example, it does not get put into that database. So it's very difficult to obtain that information without putting some staff on that task. And then it would be up to the hospitals whether they would reveal that to us. We think it's more important to have our staff on the task of doing what we call contact tracing. We are so fortunate that we have contact tracing. The counties to the south of us without health departments, they can hardly do any contact tracing because they don't have anyone on staff who does that. They don't have a health department. They would be relying on the state health department, which is trying to cover 61 counties basically. So that's an issue. That's an issue. And so we have to take our limited resources. We only have so many people who work for us at the health department. They have certain skill sets, each one of them. Contact tracing is a skill set, and actually to be able to input information into that state site where all of that is placed, actually you have to be certified to do that, and it's a very difficult certification, and it's very limited because this is people's private information, and we all understand HIPAA, and so that has been controlled access to that. So we don't feel it's necessary to take people off of that important work and put them on something else that's really, in the end, probably not going to help us stop the spread, where contact tracing is going to help us stop that spread. And in fact, just this morning, I heard something from the CDC director who said what we need is a whole national army of people who can do contact tracing for COVID-19 and for any other thing like this that might come forward. And if we could do more contact tracing across this whole country, that's how we could really control the spread of viruses such as COVID-19. I thought that was really interesting today. David, you wanted to have a follow-up?
I just want to make sure the hospitals are not providing the numbers to you in terms of those who are hospitalized. They're not providing them to the health department, and the health department has asked for them.
No, I'm not saying. This is what I'm saying is
No?
we haven't been spending our time trying to find that information out because it doesn't help us fight the virus spread in Erie County. So but it's not like we go into our database and all of a sudden it shows up that somebody's in the hospital. That's what I'm saying. In our databases, that information is not there. So we would have to take the resources away from fighting the spread of the virus to find this information, which might be interesting. And I'm sure that there were people who would like to see that, but it's not helping to stop the spread of the virus, if that makes sense.
But it would let people know how seriously people are sickened by it.
And if the hospitals want to release that information on a daily basis to us, then we would come forward and report it. But that's really up to them. It's their patients. It's their decision on what they release from their hospital records. And every health system, I think, has different policies on that. But it's not something that we're going to take precious resources and turn them that way versus turning them into doing what we know actually works in terms of stopping the spread. And that's this contact tracing, where people become isolated because they have it, and then all their circle of close contacts go into quarantine. So think about that. We have 37 people that are positive, and how many people those people have been in close contact with. we're working on keeping those people in a quarantine for 14 days so they don't spread the virus around our community. That's where our resources are really being spent, and it is the best place. It is the stuff that's going to keep us from stopping the spread. So that's where we're going to keep our resources. We're going to keep our eye focused on the important work that we need to be doing as the public health department, and we're going to trust our very good partners and our excellent hospital facilities to do their job, and that's to take care of acute care issues. Those people who are sick in our community and need that kind of care, level of care, and we're lucky to have them. Jet TV?
Yeah, hi. So I want to talk a little bit about some of the cases that we've had. I don't know if you can disclose this. Let's start with that case that was taken or transported, to St. Vincent Hospital. Do we know if he's still within the county or any update on that? Or
I don't know whether he's in the county yet or not, but I've had good reports that, recovering well.
Okay. And then my next question, do you have any idea, I guess, of the cases that are being quarantined? I know we mentioned earlier about the action that could be taken if they didn't follow the recommendation of staying quarantined at their facility or wherever they may be. Has everyone to date been following that?
In terms of whether they're staying in their quarantine?
Correct.
And we do some random connecting with people, but as I said, when you've got 37 cases and you multiply that by how many, we're talking, hundreds of people in quarantine in Erie County, and some coming off their quarantine, some are already past their quarantine. So we try to keep up as best as we can, but with the limited resources we have, we can't check with every single person every day. But we do random checks, and that's been helpful. And people know it's serious, and they've signed a document, and they know that there are serious consequences if they don't stay quarantined. But you know what? People are doing it, and I'm grateful for that. People are doing it because they know it's the right thing to do and that it saves lives. And they actually see great... Go ahead.
Oops, sorry.
Go
Just
ahead.
to follow up to that, then, do you have a ballpark? I know you obviously... there's hundreds of people probably quarantined. How many the county health department has actually specifically asked to self-quarantine?
I don't have that number, Samir. I'm sorry.
Okay, thanks.
Mm-hmm. Erie News Now?
Hi. A question for you. A, would it be possible either later this week, meaning tomorrow or next week, to get those quarantine numbers? And then B, with these new cases today, any links to other cases in the county? And as best as you know, are these people recovering at home?
I don't know much about these two new cases. They came in this morning, and here we are starting this conference at 11 today. So all I had was their age range and their address. So not their address specifically, but their zone. So that was all the information that I had, and they said they didn't have a lot else because they were just, getting going on the interviews with those individuals. Think about this. So if somebody says to you today, where have you been in the last 14 days, and who have you seen? And think about that. Think where were you 2 weeks ago today, and 13 days ago, and 12 days ago, and 11 days ago, and where did you go, and who did you see, and would you be able to recreate that? This is actually a lot of work that people don't understand maybe. So it was suggested to me, and I don't think it's a bad idea, for all of us to start keeping a little diary about what we're doing every day and who we see. So in case we come down with COVID-19, we could actually recreate that pretty easily. But that's where a lot of time is spent, and so it's difficult to get that done. And since we just got these cases this morning, I'm just trying to explain the comprehensiveness of this. And then we have to go out and contact all of those people and tell them that they need to stay quarantined. Then we got to get them to sign the documents. So it is a process. It's quite labor intensive, and I have staff working many long hours to do this kind of work because, again, we're limited. We only have a certain number of staff who can actually do this and who have the credentials to go into that site and input the information also. So I hope that helps you a little bit on why I don't have more information today about these two individuals and how difficult it is for me to even get some of the information quickly because of the nature of that. Talk Erie?
Yes, I wanted to follow up on Ethan's question again about family gatherings. Again, I think some people might be making a determination between the threat of COVID-19 and the threat of real other public health issues by not having that traditional event at their grandmother's or their mother's, or I mean, you've got 40% of the young population on anti-anxiety or anti-depression drugs. This could really lean into other public health problems. Do you care to speak to that?
I think that there are a variety of other public health problems that have already and will continue to come forward because of the isolation, the loneliness, the boredom that people are feeling. That's why we put together our what we call our community chat line, which is 273-7007, and why the state has what they're calling a warm line, 855-284-2494. Both of these numbers, people can access and speak to someone. They'll be speak to a social worker, a trained counselor who doesn't take the place of true mental health or drug and alcohol addiction counselors, but these individuals can help talk people through some of the feelings they're having, maybe for the first time in their life, but maybe it's an exacerbation of some things that they've experienced before. If you are a person who's currently under treatment, then by all means, virtually, contact the person that you've been dealing with, the psychiatrist, the psychologist that you've been talking with, and tell them what's going on with you, and have them, the professional, help you through this. This is a very difficult time, but you know, hope is there for all of us, and if you look to the hope and you look to the blessings, one of the things I've been trying to do every day is to find what delights me, something that happens in my day that delights me. And it might be a single daffodil that I see as I walk and take my daily walk. It might be a beautiful sunset, not today, but on other days. It actually might be the snow and the fall. Snow is beautiful when it falls, and maybe that's it. But find the positive things in your life, and I guess I can't encourage people enough to think about that, and to think about that you are a hero when you stay home, that you're saving lives. You know, I have had numerous people contact me about numerous things, and someone I know contacted me because she was getting a lot of pressure from family members who wanted her to go see her mother, and she knew her mother was compromised health-wise, and she didn't feel it was right for her to go in her mother's home, and her brother was actually doing more of the care, and he didn't go many places, so he was much more socially isolated than she was. And she asked me about it, and I said, you're doing the right thing for your mother. You're helping to save your mother's life. And so those are the things I think you need to think about. You would not want to be the cause of someone contracting COVID-19 and then having a tragedy happen from that. And that's, I think, even worse for people than maybe dealing with the boredom and the isolation that they might be feeling now. These are tough situations. These are tough times for people, and I certainly understand that, and I don't take this lightly myself. So I just wanted people to know there's help out there for them, and we want them to reach out for that help if they need it. Erie Times News, do you have any last questions?
Yes, Kathy. With the releasing of the map that shows the regions where the cases are, can we expect breakdowns in the near future on cases by gender and by race?
Again, those don't really help with stopping the spread of the virus. What we're trying to do is save lives here and stop the spread of the virus. Does it matter if someone is 20 or 60 and has the virus in terms of the spread? Does it matter if someone is a male or a female? Does it matter if someone is black or white or yellow? Does it matter? That's the kind of thing I'm always looking at. What is the information that people can utilize to make better decisions for themselves and for this community as a whole? And so even though these things may be interesting and they're obviously great for researchers going forward, and I think there'll be a lot of research done on this when they will gather that data, but having the race or the gender in Erie County right now with 37 cases wouldn't do anything for any study. You know, my background is a science background. I understand how truly, you know, studies are completed, and 37 people is not enough people to have any to bring forward any interesting data that means anything. It's just not enough of a conglomerate of cases. So anyway, I don't see us changing what we're doing right now, but again, everything that we do, we are looking at, and if we find it's valuable and we're going to bring the information forward, we'll do that. And so we are constantly looking at all this, but there's no talk of us changing and adding more information in the near future. Jet TV, do you have any last questions?
Yeah, so I kind of have two, so bear with me a little bit.
Okay, Samir.
I've received a lot of questions regarding, quote unquote, a recovery from COVID-19. So obviously we know if you are positive for COVID-19, you go into quarantining for 14 days, etc. You're not hospitalized if you don't need it. So is it safe to assume the positives out of the 30-some cases we've had, those beginning cases, those are all technically, quote unquote, recovered cases?
It's safe to assume that many of them are now. Now remember, quarantine is different than isolation. So when you are positive, you go into isolation, which means you are completely by yourself. And you know, we've seen famous people talk about this on some of our national TV programs. And people bring you meals and leave them at your door, and you stay by yourself. Once you are done with your symptoms, then you should stay in that isolation for 72 more hours. So some people, symptoms are done faster than others. So how long they are in that isolation really depends on how they react to the virus. Quarantine is for the people who had close contact with somebody. They are asked to stay quarantined for 14 days because for most, what we've seen and the studies are showing, if you don't show any symptoms within 14 days, then you did not contract COVID-19 from that person. Obviously, that doesn't mean you couldn't contract it from somebody else after that 14-day quarantine and you're out with other people again, but that's the difference. So let me think about what exactly was your question now. I was trying to explain the difference between that. But yes, to your question was, do we have people?
Process, how many?
We have people, I'm sure, that, and I know there are a few that we've, that I actually know of who have completely recovered, and now they're back to doing what I'm asking everyone else to do. Stay physically distanced from people, you know, wash your hands frequently, do all those things we've been talking about. So yes, we have people who have completed their time. There have been 72 hours past any symptoms, and now they are out there doing what the rest of us are doing. Is that it for you, Samir?
Yeah, thanks.
Okay, thanks. Erie News Now? Do you have any last questions for me?
One final one for you. I've received a handful of questions from viewers, specifically about rental properties, usually along the water, and they're just looking for guidance there about, A, are they able to rent them out? And then on the flip side, I've had people asking if a property near them is a rental and they see somebody moving in there, what should they do?
So we are saying that if it's your permanent residence, the place that you live, most of the time, there are some people, maybe they're permanent residents in Florida, but they spend 5 months of the year up here, and they have a home that's their own, then they can come back to that home. Again, back to the things I asked about those people in the beginning, to stay quarantined for 14 days. But if you have a rental property, then that's just a temporary, you know, a week or a month at a time. You should not be renting that out to people. You should be just keeping it until this pandemic is over, because what we don't want is people coming from other parts of the country into our community and potentially spreading COVID-19. And Talk Erie, do you have any final questions?
Just very quickly, we're 3 weeks away from May 1st, and I was just wondering if there's been any guidance from the governor or from any of the state departments regarding exit plans on the county level, what they're planning on doing either regionally or by business type of kind of starting back the economy. Any planning going on just yet?
I haven't heard of any plans on that at this point. You know, one of the things we've all talked about, which would be great, is if we could find a way to test people to see if they have had COVID-19, if they're immune from having it again. Because if we could find out who those people are, obviously they could go back to work. And I know there's lots of research being done in that area to try to help get that test. That would be a game changer for the whole nation. So let's hope those scientists can find that sooner rather than later. But I have not heard of any plans yet from the state level on getting businesses back up and running at this point. Well, thank you all for joining me here today. Thank you for joining me a little bit early. Tomorrow I will be back at 3 p.m. for a briefing on Saturday. And in the meantime, stay warm today. It's a little chilly out there, but hopefully you have a nice warm home to be in, and you can stay home, and you can stay safe, and you can stay calm. Thank you.